Hello, welcome back, friends, to Ridgeview's podcast, where we cover everything hope, healing, and recovery related. As we always like to do, draw your attention to our helpline number. This is part of our COVID response team effort. Please know that helpline has trained counselors that are available 8 a.m. to 8 p.m. every day of the week. If you feel you're in need or someone that you know is in need, give them a call. And again, thanks for tuning in. Don't forget to subscribe to our channel, and as I've been told, ring the bell so you'll receive the latest alert. My guest today, this is awesome. I'm so glad you're here. Nathan Zeiger, our esteemed Chief Operating Officer. Now, our viewers may not know, but you and I have been called brothers by a vast number of people.
Yeah.
So
brothers from different mothers.
That's what they say, that we have a strong resemblance. Now, I did shave this morning, so that does distinguish us. But we'll let our viewers decide, do we look like brothers? So,
yeah. Actually, we've been in places where Michael's been called Nathan and Nathan's been called Michael.
So if we mix it up today, we'll understand why.
Thanks for having me on the world-famous Ridgeview podcast.
Yes, and growing. So what I'm excited about today is this topic of timely access. Now, I thought it would be kind of cool before we launch into how Ridgeview is addressing timely access is kind of setting a broader stage. And I'm not as familiar with the arc of the history of how same-day access fit into behavioral health, but tell me a little bit about your sense of where that came from and what may have been some of the driving influences in same-day access for behavioral health care.
Yeah, I think to understand the concept of same-day access for behavioral health, it's important to first understand just context of what accessibility means to people. And, you know, there's a lot of examples of that in everyday world. Take restaurants, for instance. You go to a restaurant and you want to be seated as quickly as possible. And so if you have to wait to get in, how do you feel about having to wait to get in? And certainly, depending on the quality of the food and your experience with that particular restaurant, you may be willing to wait longer. But most people don't want to wait a long time for things. Now that's food you're talking about. When you're talking about health care, whether it be medical or behavioral health care, when you have to wait for that, it could become more problematic. Certainly we know that from a medical standpoint, if you have to wait for care, that you can get sick. Right. Well, you can get sick in behavioral health too, and if you can't get the care that you need when you need it, bad things can happen. Right. And so historically in behavioral health, it has been common, probably up until maybe the last 10 or 15 years, it was common to schedule everything, schedule appointments ahead of time. And only until recently has the concept of same-day access been really in play with behavioral health. Being able to come into a location and get help for your behavioral health needs on the same day that you've acknowledged that you need to get help. And I think that's a very powerful thing.
And when you talk about scheduling ahead of time for a need, I mean, you're probably talking anywhere from 3 to 6 weeks or maybe even longer to be seen to have a medical need or issue addressed.
Yeah, I mean, I'm so passionate about the subject matter because most of the time people do have to wait And how do you create systems where folks do not have to wait until same day access? And when we say same day access, we're not just talking about therapy or med management or just getting an intake. I think you're talking about a system of access, right?
Yeah.
So whether it's same day or a next day type of scenario or in 4 or 5 days, right, you're decreasing the time that between when the symptoms are there and when you're getting help. Now, obviously, best case scenario is you could do that in the same day. But up until very recently, the emergency room has been the only place where you could get access the day your symptoms are acute enough, right? And think about that I'm not doing well. I have I'm sick, right? And I have to go to the emergency room in order to get help. Well, really, creating systems of access is necessary so that if I have a need today, for whatever reason, I've acknowledged that my depression has been something that's getting in my way. And I'm saying I need help. I want to seek help. That I don't want to have to wait 3 weeks and schedule an appointment to get help for my depression when in 3 weeks I may not be in that same frame of mind. I may not even want the help in 3 weeks. And it's when you think about it, it's somewhat ludicrous that I'm acknowledging today that I need help and I have to wait for 3 or 4 weeks in order to get that. That's really, now we know that, especially in the mental health world, in the behavioral health world, that being able to provide that access as quickly as possible, as timely as possible.
Yeah.
And I think we also have to make sure that we acknowledge that with as much quality as possible.
Yeah. Well, you hit on a couple things there that, we could take a couple different branches. Certainly, stages of change and a person's readiness to act on getting the help that they need is one avenue. You use the word timely, and I love that word. We've talked about this numerous times. That adverb on top of access, here at Ridgeview, I know we co-join those things. Portals of access is one thing, but timely access just amplifies the importance of it. But I want to go back to, when you're talking about the emergency room, I love this parallel, aspect with, say, medical care. I have a dermatology issue. I call the dermatologist, and I can't get in for 4 weeks. I break my arm, and I can go to the emergency room.
Exactly.
If I am feeling hopeless, depressed, sad, maybe I've gone through a traumatic loss and I'm needing help with the grieving process. I can't wait. I don't want to wait 4 weeks to initiate that process. So through mechanisms like same-day access or our walk-in clinic is one way that we've tried to hasten that process.
Yeah, think about that. I mean, I have anxiety, and my anxiety is not exacerbated to the point where maybe I'm actually contemplating hurting myself. And so, in years past, because it's not an emergency, even in the behavioral health field, we've created, mobile crisis teams. We've created systems where folks could go if their symptoms are exacerbated or symptoms are to the point where they're thinking about hurting themselves, right? But why should you have to wait until that point for you to get the help that you need? I mean, think about it. That is just nonsensical.
Yeah.
And because all it does is it's creating this system of emergencies, right? And so then you can get help that same day. Like you can walk into a mobile crisis unit or you can walk into an emergency room and you can get help. But why not get the help before it becomes a crisis? And in order to do that, you have to create systems of access. The difficulty is, your next question is probably going to be along the lines of, it's not just how do you create systems of access that can really make sure you're getting everybody the care that they need when they need it, and that is the problem, right? You create systems and you create framework, and those things are fantastic, but really what this comes down to is on an individual level, and we deal with that all the time, right? So we here at Ridgeview, we created same-day access in a number of different places.
So tell us a little bit about what Ridgeview has done, how our mechanisms of a walk-in clinic operate in our 5-county service area.
Yeah, so you can walk in between 8 and 9 any day of the week, Monday through Friday, and you can get an intake, an assessment for your needs. And that's something that we implemented several years ago. But that has spawned other ideas, and so we have our medication management, scheduling. We changed whole scale a couple of years ago, where we're no longer scheduling appointments, months in advance or weeks in advance. We're scheduling appointments within 3 or 4 days of when you need to come in. We've actually gotten to the point, and this is why this is really the challenge, is we've gotten to the point where we've been able to get next day appointments, but that is always where the struggle is, as I was getting to, is you create these portals of access and people use them, right? We know that now, that folks are using them, and it creates more demand. And so you have to make adjustments in order to meet that demand, because the issue is not at the system level. The issue is at the individual level. And so we can serve 10 people today that walk in and get the help they need today. But say we have 15 people show up. Those other 5 people, what do we do there? How do we make sure that they can be seen? And so for those 10 people, they're going, that's fantastic. I got the help I needed today when I needed it. But those 5, say we can make adjustments to see 3 of those 5. And we've done that, like through the use of televideo, right? Now you have 2, though, that you didn't see. And those 2 are saying what?
Why not me? How come you're saying you provide this, but I didn't get in?
For those 2, you didn't give them access, and that is what we have to be about. It's the continuous monitoring and implementation of different countermeasures to be able to get to those 2 people.
So, and you highlighted a couple of things where Ridgeview has continued through their plan, do, study, act process, expanded and modified the change efforts to introduce teleconnectivity to help with those overflows, for lack of a better word, to connect people through an evening at some clinics. There are some evening opportunities now. When you look ahead, say 5 years from now, when you think, wouldn't it be cool if, how would you finish that sentence?
Yeah. Well, before I get into the 5 years from now, you've brought up 2 things that I think are wonderful to speak to, and the first is think about after hours walk-in, right? We just started that 2 years ago. I mean, it's not like this complex idea, right? I mean, we're providing outpatient services on Monday through Friday, but we have families who people work, right? We have individuals who work during the day, and they would have to take off of work in order to, and it seems so profound, right? But it's not easy. You have to create those systems, but those are so important. We've created therapy in schools so that families don't have to go get their kid and bring them into the office. That's creating points of access. And that is a beautiful thing. You think about that. Not only does a parent have to take off of work, but the child misses parts of school. I mean, again, how do you continue that? So, you asked about 5 years. I think our continuation of trying to get to people coming for med management that don't have to wait, that can be seen today, if they need to be seen today, I think will not only significantly improve outcomes for those people, it will decrease hospitalizations.
Well, you have described a wonderful future that drives everything that we do here at Ridgeview, and I think that's a perfect way to summarize this discussion of why timely access to quality behavioral health care drives so much of what we do here at Ridgeview. I really appreciate you coming in and talking about this. I think you framed it beautifully for the listener on why accessibility is so important. My notes here indicate that on a future episode, you and I might delve into some of the wonderful parallels, but also significant differences between the Notre Dame Fighting Irish and the Michigan Wolverines. So it's one of the things that distinguishes these brothers.
Yes.
So thank you for being here. Thank you for tuning in, folks. We really appreciate it. Please make note of the helpline if you need it. It's there for you. As we mentioned in our comments section, this podcast is made possible in part from funding from the Department of Mental Health and Substance Abuse Services. And we hope you join us next week. Take care, everyone.